Chronic pain in the elbow is most typically due to a tendinopathy or a kind of really chronic golfer's or tennis elbow. And what happens in these conditions is where there's micro tearing of the tendon as they attach into the bone on either side. On one side it's often referred to as tennis elbow and on the other as golfer's elbow. And these are actually known as an epicondylitis. The epicondyle being the area, the bone in which those tendons attach onto, and through overuse and repetition, we can get some micro tearing. But the body isn't designed to do that, and so there must be some form of overuse occurring compared to the normal efficient amount that should be happening. And so we need to start to question, is there actually a problem elsewhere stopping this from healing? Is my elbow consistently being overused to compensate for a problem elsewhere? Most commonly in the case of chronic elbow pain, we actually see some weakness in the shoulder. And so going after the weakness in the shoulder can be the cause of the issue. If the tendinopathy is not the cause of the problem, sometimes chronic elbow pain is a referred pain from the neck. And so these are all things that we need to start to look at in understanding perhaps why this problem has not gone away. So for you, in terms of practical advice, with anyone who has chronic pain, we first need to understand it. And so we really advise you to go through the pain education section of this website to understand a little bit more about what pain is, why it happens, and why damage may not be the cause and the reason why you have pain in the first place. Because you could have chronic elbow pain and have no damage to that joint at all, and very often there is no tearing at all. And so for you at home, doing that is the first thing. Secondly, in terms of mobility, we can do some wrist, elbow, shoulder and the neck mobility, because we need to look at the whole unit and how we use that chain of muscles and joints as one whole unit, because anytime we go to pick anything up, it's the whole thing that we have to use. And so the cause of your issue is anywhere from the hand right through to the neck and the mid-back. And so looking at past injuries through that limb is really, really important to try and understand why this issue has not gone away. If the chronic tendinopathy is the cause of your symptoms, then rehabilitation of those tendons is one of the most important parts of recovery. Because there has been some micro tearing, we need to actually change the structure of that tendon. Now, this isn't a quick process, but through loading of that tendon with resistance training, we can slowly change the structure of the tendon to be more resistant to forces and handle more load. And so what this means is the management of pain during that process is important. Using some kind of support to take the pressure off is something that we can talk to you about in the clinic. And we see these circular straps that can be used, can be really, really helpful because they act like shock absorbers. But you need to make sure that this is worn below the level of the bone to take the shock on the way up, and so that then the tendon is not having to do more. We then need to monitor the amount of activity that you're doing, because if you're constantly flaring up the problem, you're recreating inflammation and it's constantly in a healing cycle, it's never going to get better. So we have to be really, really, really good at taking away painful activities and triggers and slowly grading ourselves or gradually exposing ourselves to little bits of movement, harder and harder and harder, slowly but surely over time, and building up the effort so that we can do just below the amount that we can handle, and then that tolerance will increase, and as that tolerance increases, the pain will reduce alongside it. So to summarize, mobility of the whole arm, neck and mid-back is important. Taking away painful activities or triggers and using some kind of support to take away the shock towards those tendons is very, very important, and gradually get into a place where we can start to load up with strength training to actually change and adapt the structure of the tendons to handle more load. If the pain is due to a referred pain from the neck, then we need to decompress the neck with mobility exercises, and we need to look at the nervous system to find out why those muscles won't relax in the first place, which is something we're going to be doing in the clinic alongside you.